Thank you, Elizabeth. I'm excited to be part of the conversation today and really to be discussing the initial framework for the district's health pillar. As you know, we've been having this conversation, as you kind of referenced, for quite a long time. I think going back a couple years, we were starting to develop the initial vision for what this could become. And we're so much closer today to kind of laying that out and sharing it with the members and starting to talk more. So that's exciting to be at this stage and this kind of milestone. You know, certainly health is a little bit outside the framework of traditional 2030 districts, which focus primarily on climate mitigation and emissions issues. But our group for a long time has had this vision of creating this health component, this healthy building component of our sustainability district, essentially, recognizing that there's just an enormous opportunity in this space that we as a community and we as a district can really take advantage of. We've all seen kind of this continued growth in the health and wellness space. And I think it's been keenly felt on the corporate side. A lot of companies are leaning into health and wellness opportunities for employees. They're using it to attract and retain talent. And they're certainly using it to ensure that their employees are healthy and can support the organizations that they're working with going forward. But there's also this growing evidence that building related health improvements can actually improve the way we work, the way we perform, our focus, our cognition, our ability to handle stress and crisis response. And while these things aren't entirely surprising, I think there's this whole segment of the population that hasn't fully kind of clued into this, in part because the research is new and we're learning new things every day. So part of our vision from the beginning has been, how do we connect, the sustainability leaders, the health leaders, the building professionals with these human resource leaders in the community to have these conversations, to kind of unlock this new science and put it to work across our members. And this is becoming, I think, more evident across the sustainability space in general. I remember being at my first Green Build conference, the flagship USGBC event a few years back, and seeing how much the focus at this sustainability environmental conference is shifting towards wellness as a key priority for the community. And again, in some sense, that's not surprising. It's a group of people focused on, the health of the environment. And this is just putting a little bit more focus towards the health of the individual and the occupants in these spaces that we're creating. And luckily, we're getting better at this. A big part of this movement is being driven by a group of thoughtful leaders at the International Well Building Institute, which has developed a new standard, really the standard for healthy buildings today. The Well Building Standard launched in 2014 and really continues to build upon the latest science in this space, the latest research telling us how to design and operate buildings in a manner that's going to have a better impact for the occupants in those spaces. So just like the US Green Building Council and LEED do for green buildings, IWBI and WELL are doing for healthy buildings. Recognizing this expertise, a group of us who are involved in the 2030 effort early on, were kind of eager to bring IWBI to the table for what we were doing, wanting to make sure we were leveraging their expertise and their experience. And we're very fortunate that they, I think, saw a similar opportunity in collaborating with our community in the work that we were trying to do with the 2030 district. So in tandem with the IWBI team, we kind of set out to develop a simplified framework that would be supportive of what we were trying to do in the Cincinnati 2030 district, trying to figure out what the standard was or what the goals were for our membership to achieve, which, in the health space isn't always as easy as maybe it is on the energy side, where it's easier to kind of calculate and report on what those metrics are. So the Well Building Standard has over 100 different building features, optimizations, which you'll hear more about today, which touch on, lighting and materials and the impact of creating more movement-oriented space. And naturally, we wanted to focus on those that are kind of most core to our community and most beneficial to our membership. So IWBI made a recommendation that we start to investigate what are the key health drivers in our community and how we could integrate that into kind of the pillar that we were trying to create. So as we started to do our research, we very quickly identified the Health Collaborative as a leading partner in the local community. They've got extensive relationships with the region's hospital network and other healthcare providers, and are really supporting and developing research in these areas to understand what's happening in the Cincinnati community. They create this report, the Community Health Needs Assessment, which provides all this data and really was a great tool for us to understand what was going on in the community. And you'll hear a little bit more about that today. We also looked at another key data source, which was health insurance claims data. We developed a relationship with one of the region's leading healthcare providers or health insurance providers and utilize their data set to understand exactly what sort of health claims employees and building occupants across the region were actually filing and what that told us about their health needs. So we use these two data sets, looking at these 100+ features that WELL has, and identified those that we thought provided the most value and benefit to our membership. So excited that the team's able to share more of this with the membership today. It's really the start of a broader conversation that, as you heard, began at least a couple years ago, and we're now engaging the members on part of those conversations. But a few more experts to share more information with you. First up is Dr. Lauren Bartozzik to offer some more detail on how the Health Collaborative plays in this space and the benefits they bring to the analysis that we've tried to do. Dr. Bartoszek is the manager of population health strategies, working across the region and utilizing the health needs assessment to understand policy issues and systems issues and provide recommendations to the community. She's got a PhD from the University of Cincinnati. She's done 10 peer-reviewed papers on various health topics. So an extensive amount of knowledge that she brings to the equation, and I'll turn it over to her to continue the conversation.
Hi, good afternoon, everyone. I'm really happy to be here and to talk a little bit about the Health Collaborative, the work that we do, and then additionally this community health needs assessment. Next slide. So at the Health Collaborative, our vision is that Greater Cincinnati is healthy by design and everyone is connected to quality, affordable healthcare. And this is what drives our mission towards the triple aim, which is healthier people, better care, and lower costs. It's really important to note that the Health Collaborative operates as the health information exchange for our region. And so all of the 6 big health systems that span the Greater Cincinnati and Greater Dayton region all are members within the Health Collaborative. And so we've got a really personal and intimate relationship with them that helps us navigate the world of healthcare and how they respond to community health needs around the area. Next slide. So it's always a sort of a running joke that we do so many different things and we take such a span across so many different interests that it's sometimes difficult to describe. But in short, we really run across data-driven efforts to provide quality improvement opportunities for our healthcare partners. And we have a deep focus in population health. And so we do our population health work by bringing together those that are most interested in the good of the community. This oftentimes includes our healthcare providers and all of our representatives at our healthcare systems, as well as community organization partners, behavioral health, social services, faith-based institutions, coalitions, and community members and residents. It is important to note that given the past year that we have all been a part of, the Health Collaborative does house the region's disaster preparedness coalition. And so we've been really central to the response for COVID-19 for this region. As a result of that, and despite the fact that it actually kept everyone out of their buildings for a year, we have been really working hard with the systems and the hospitals around the region to create a collective response. What is the region's collective effort and response to this type of situation, and how can we address the needs from a regional perspective. And it looks like that last part got cut off. I don't know, but it's about actionable data. And so one of the wonderful things that Health Collaborative does is provide real-time data. Through our Health Bridge portal, our data analytics and data architecture folks within our organization are able to provide daily, sometimes hourly reports for our hospital members so that they can update their policies, programs, procedures in response to the need as it is. So typically over time, those reports might come on a less regular basis. But as a result of COVID, we were able to utilize this platform as an HIE to provide information to our members on a day-to-day and sometimes hourly basis. And that proved itself to be very efficient and also very useful, and not only an opportunity for us to see the data from the regional perspective and the need of our communities, but then have our leadership and our hospital members be able to respond. Next slide. So the population health strategists that I work with at the Health Collaborative are a team called Gen H, or Generation Health. And our general philosophy is that everyone should have the opportunity to be healthy. Our focus is around health equity and what it takes to achieve that for this region. Next slide. And so Gen H specifically was a collective impact model approach driven by some of the United Way's bold goals a few years ago. The Health Collaborative and the Gen H team specifically has a mission to align the region's collective efforts around policy systems and environmental strategy changes, as well as the social determinants of health, which includes things like economic mobility, education, neighborhood and community context. To do that, our goal is to utilize data from the Community Health Needs Assessment. And so a bit of context, if you're not familiar, the Community Health Needs Assessment is a requirement for nonprofit hospitals in the region. It is also a requirement for public health departments and local health departments. So any health department that exists at the county or city level is required to do this for their accreditation, and nonprofit hospitals are required to do it for IRS standards. So as a region, and with so many systems in hospitals and health departments, we're pulling together these efforts to create one regional approach to completing this data collection. This happens on a 3-year running period. And so the report that was able to be used for the 2030 district provided a very high-level overview of the top identified health needs for this region. We'll actually be conducting this again this year. Data collection is in 2021, and we're very excited to be able to bring together over 25 health departments, 39 hospitals across 6 systems and 3 states, so the tri-state area, to do this data collection work. Our primary goal this year is to center health equity and to produce a report that can be valuable to all partners in the region to go on and do their work so that we can all sort of ladder up to a universal goal. The 2030 district is a great example of how we would love this report to be used to drive additional projects and to push additional success in areas around health and population health. And so we are very excited to be a part of this and to have this report be a part of this project. And the end, I think that that's all I have for you about the CHNA.
Dr. Bartozzik, thank you so much for the background. That's really helpful. And hopefully the group understands the degree to which the collaborative is investing time into really understanding the new needs of the community and how beneficial this has been to us so that we can pair this with the latest science developed by IWBI in the well building standard. So joining us today from IWBI is Dr. Angela Loder, who's VP for Research. She's responsible for identifying, directing, and managing the evidence-based research that supports really that underlies the well building standard. She's got over a decade of experience in this area and has been a great collaborator with us in our process. With her is Dominic Ruiz, senior policy role with IWBI. Dominic supports relationships with governments, NGOs, nonprofits, in trying to encourage the health work that they're trying to get these communities to do across the country and really throughout the world. He's also been a key collaborator for us and ensuring that our organizations are aligned. So a big kudos to him and the team. But Angela, Dominic, take it away.
Sure. Thank you very much, Jeremy. In a year that was filled with confusion and uncertainty, one thing that we saw became crystal clear in 2020 was the role that our built environment plays in our health. And I think it's important to emphasize that Cincinnati was thinking about this before COVID. And I think 2 years, in fact. So it's just a testament to the great leadership of Cincinnati 2030 and the innovative thinking that's happening in the city. And you all should feel very proud to be leading the pack and be a catalyst for other cities to not only consider the role of buildings and addressing climate goals and climate change, but also improving health and performance in buildings and ultimately in cities. So with that, for those who are unfamiliar with our organization, the International Well Building Institute, I will pull up my slides to give you a brief overview. Give me one moment. Oops. All right. So the International Well Building Institute, the International Well Building Institute, our mission is to improve human health and performance through building, workplace, and community design. And since 2014, this mission has been advanced through a system called the Well Building Standard, which is a performance and evidence-based program for measuring and improving the health impacts of buildings and communities, where we spend 90% of our time. The Well Building Standard really revolves around 10 concept areas. So it's addressing aspects of air quality, water quality, nourishment, light, acoustics, thermal comfort, active design, and biophilic design, just to give you a brief sense of the breadth of this work, which is comprised in over 100 features spread across these 10 concept areas that can be customized and applied to different health outcomes, needs, and goals. And also by attributing things like the geography of a building or a community, the space types, the building infrastructure, and also mapping that in a way that we've done in Cincinnati with locally specific health concerns and also goals related to health and wellness to create a customized solution that is bringing the most effective strategies in a given area. And one of the most important pieces of this system is the third-party verification of the Well Building Standard, which really is validating that you are indeed operating and operating a building or a space that is actively contributing to healthier behaviors, healthier habits, and also just passively creating a more holistically healthy environment. This movement, which again started in 2014, has grown very rapidly. There are now 5,000 projects across 66 countries. And that rapid growth is really was only made possible through our global community, which in the same time, or actually less, the Well AP community was launched, which is similar, if you know, of the lead accredited professional is the sort of health and wellness analog to that accreditation. But there are now 16,000 of those in 98 countries that are really working every day to advance this cause. And that's been especially critical during the pandemic as we have assisted building owners, operators, employers, small businesses in reopening our buildings and really our economies. This Well community, this Well AP community that I mentioned is just one piece of an ecosystem that really is powering this movement. And that is not only the Well APs, but a cohort of advisors, a task force that was launched among many other task force devoted to COVID-19 response, Well faculty members, which are really the teachers, the educators of the Well building system, and users and project teams. And this is ultimately helping us position well and really buildings as a tool for public health. And that again has become so critical today as we continue to figure out how to reopen buildings and spaces safely. And this one product of our task force on COVID-19 was a well health safety rating, which is designed specifically around the imminent concerns related to and respiratory issues like or illnesses such as COVID-19 to help give occupants a level of trust as they consider going back to work or back to school and so on. So that was one of the recent programs that was launched this summer. And I think that will then take me to Angela's part of the presentation.
Great, thanks, Dominic. So I am going to, I'm so glad we went after Lauren because, go back for one slide. Glad we went after Lauren because she's given a great introduction on some incredible work. Was taking notes furiously, thinking, oh my goodness, I can't wait if we can collaborate on that data. And I'm going to talk a little bit more about sort of stepping back from our perspective that we've seen with a lot of our clients and researchers that they don't always know, like, what does adding health mean? And we had this conversation with the Cincinnati 2030 district. What do you mean by adding health goals, right? Like, what kind of definition of health are you using? What do you mean by that? How do you choose health goals? How do you measure these health goals? And how can you track progress and outcomes? So I'm going to give a step back, a little bit of background here on what that means for us as an organization and how we translate research to practice. And then some of the ways that we track and give you evidence that'll enable you to benchmark some of this progress. Next slide. So I think it's really important to always understand what we mean by health here. What do you think influences your health and your well-being? What do you think the building influences? Now, the reason I ask this is because I know there's going to be some of you that think risk reduction, right? If you got good air quality, especially in the time of infectious disease, then it's a healthy building. And there's others that come from more of the health promotion approach. Do you have workplace wellness programs? You encourage an activity trackers? And the reality is that, next slide, that we are products of our history. How we approach health and well-being is influenced by our prior exposure to various social, economic, and historical factors. And whether you yourselves are taking on these health pillars or you're trying to convince maybe your C-suite to do this, you will have to address these values that people have about what really matters in measuring health. Next slide. And the reality is, as you can see from this slide, that the 2/3 of our health status, our health outcomes, really come from physical and social environment and lifestyle and health behaviors, which really means policies, programs, and operations of buildings in many instances and the communities in which they're situated. And these economic and social conditions that influence the health of people and communities, these are called social determinants of health, which Lauren had mentioned. And these are the kinds of data that are reported on in local public health data, as well as global and national public health data. Next slide. And this is more commonly referred to in public health as a socio-ecological approach. And this might be a new word for many of you. We use it all the time, but I always find it's good to give a reminder of what it means. And it recognizes that how different facets of the environment shape your health and your behavior. You can tell people that they need to bike to work, but if they have to cross giant highways and it's unsafe to do so, or it's 3 hours to get there, that is not a reasonable choice. Right? So it's understanding those barriers and those systems that enable health equity across different regions. The WELL Building Standard uses this socio-ecological approach, and the innovation here is using buildings as a public health intervention. In other words, even if people don't participate in, say, workplace wellness programs, they're going to benefit from cleaner air. They're going to benefit from better, natural daylight. They're going to benefit from, say, plants and healthy food in the office. And it's important to note here, though, that while there were certain features that were selected as part of the health pillars for the 2030 district here, and those, you need to start somewhere. It's really important that those were chosen that link most directly to local public health data. Because so many of these things are interrelated, the best results you're going to get, of course, are having a more holistic approach. Right? So always keeping that caveat in mind that the ones that were chosen were the ones that were easiest to pull out and to get data on sort of on their own. But of course, there are multiple factors that influence health outcomes. Next slide. So how do we measure health? Next slide. So research, as was mentioned before, is the backbone of the WELL Building Standard, and we do this a lot of different ways. We are in a fairly unique position in that we translate research to practice, and then we get our projects and clients to tell us that information back. So we use a combination of peer-reviewed papers, best practices, and emerging evidence, which was really apparent during COVID-19. We're translational, so we both give feedback and try to translate this into standards for buildings that are both locally applicable and global, as well as getting feedback from our clients. Hey, this just isn't working in India, for example. Interdisciplinary, so we really are we're agnostic. It's not air quality or bust, it's not physical activity or bust, it's a combination of all of those factors. We are quite unique in that we have both objective and subjective metrics, and I'll talk about that more in just a moment. We are data-driven, so we have portfolio-wide benchmarking. We have comparative metrics and performance targets. So particularly for those that have portfolios, there's a really easy way to be able to test how you're doing across your portfolio or across your peers. We also evolve. We aim to be as transparent as possible in what's the state of knowledge, why do we make those decisions for choosing this feature versus that feature, and how do you deal with upcoming emerging opportunities and gaps and trends. The Global Research Agenda, which the research team authored, is coming out next week, and it's really a call to action for businesses and governments and policy on top catalyzing impact topics that will really help move health and buildings forward. Next slide. So again, how do we measure health? Well, we do it at multiple different scales, so that everything from a small scale study to building level, for example, circadian lighting and daylight, to community scale data, regional, national, and even international. And one of the most common types of data you'll see, which is often used in community health reports, is public health population trends like the rate of obesity, the risk of physical inactivity. Next slide. And this means that we're balancing in WELL Building Standard national level data, like I mentioned, chronic disease trends. We have a country briefs based on the International Health Metric Institute's risk factors. Regional level data, so local public health trends, so Robert Wood Johnson's county health rankings, or the Thrice yearly health assessment that public health agencies have to do, as well as building level data. What's the satisfaction on indoor air quality performances, indoor environmental quality, health and performance metrics. Next slide. The problem is that global or national health data, which we have to use in many instances, doesn't always match up to building level data or city level data. Are healthy cities, does that automatically mean that you have healthy buildings inside them? Next slide. And this is really where the innovation, and we're so excited about these health pillars for the Cincinnati 2030 district. Linking local public health data and building level interventions is the first instance globally that we've seen this done. And in fact, we've had people clamoring to be introduced to this organization saying, please let you know how we did this. We'd love to replicate it. Next slide. What's innovative about this? The innovation here is scale, right? So localization needs versus a global standard. So of course we have to have globally applicable standards and use health data. We couldn't possibly have a separate separate WELL Building Standard for each individual region, but we always have said a gap here is the localized data. This is doing it, and we are beyond excited at the opportunity to be able to tailor this and customize this for local needs. It's ecological, so it's linking climate initiatives with building level actions on health, and it also comes with metrics. It comes with ways to track and evaluate your progress and benchmark against your peers. Next slide. So we have a couple different ways of doing this. Dominic has mentioned that we have verified performance for all WELL certified buildings that come in and test your environmental metrics on air quality, water, light, thermal, comfort, and acoustic considerations. Next slide. We require occupant surveys. So this is a way to get data on perceptions of indoor environmental quality, perceptions of workplace wellness institutes, and health status. We benchmark, so we benchmark our progress and impact. It's data driven, last slide. And we can track your progress across your performance in your portfolios for dynamic onboard scorecard. And that's it.